Wednesday, February 19th, 2025, 1:30. We're here for the Board of Health meeting. Call the meeting to order. Executive session, discussion with legal counsel about current or potential litigation under NW Code 42.30.110. Section 1, subsection I. And for this meeting, we will require to include the full board, Brandy, Janae, and Chris Kirby for 15 minutes.
Oh, so it's not for an hour, so 15 minutes, that's good. Okay, that's good.
So we will reconvene at 1:45. So the time is 1:42. We've come out of executive session with no discussion, with no decisions being made. Moving on to approval of January 15th, 2025, regular board health meeting minutes.
I move to approve the January 15th, 2005 regular board.
Second motion.
Motion and a second. All in favor, signify by saying aye.
Aye.
Aye. Motion passes. Public comment. Do you have any letters or concerns, questions were brought in? Anybody participating virtually using teleconference software or Zoom?
And I believe there will be 2 more public comments, and so I'll go first. That should get them kind of up here as well. So are we? That might be Susie. Is that you? Raising your hand? Oh, no. Okay, so that's Susie, our union representative. So I'll go first then. So
Please state your name.
my name is Brandy Williams, and I come to you today as a representative of the BFHD Protect 17 chapter members. And I'm also the president of our agency's chapter. So as an advocate for my colleagues and for public health, I have poured my heart and soul into this work. It is hard work, but it is good work. As you all should know, collective bargaining for our 2025 to 2026 contract is still ongoing. Our bargaining team members, including myself, have spent many hours putting in the work to ask for better conditions at BFHD through our contract. The top priorities amongst members have been 1, wages, and 2, benefits. To speak for myself, I can share that I hold a master's degree in public health, along with an additional graduate level certificate in epidemiology. And that's the career track I've aligned myself with. I am an epidemiologist in the communicable disease department. I went to college at state colleges in Montana, which rank fairly reasonably on tuition costs. Still, my student loan payments are $400 every month. I make $36 an hour. This is less than my brother with a high school diploma makes as a farmhand in rural Montana. It's no surprise to any that inflation has gone up, and so has benefits. The difference between my November paycheck and January's was $200 less. With the 4.75% COLA that was excruciatingly fought for in the current proposal for bargaining, that COLA will not only cover that $200 difference, but it will still be taking $10 away from me. In bargaining for our staff, we are fighting to just get above break even with collective bargaining. Now, I recognize there are funding cuts. I will not feign ignorance over that. We live in some really uncertain times. However, the staff here is hurting. They are frustrated and feeling unappreciated. We take a lot of risk being in this work. I personally have been in the groups of many people here that have now been on site, putting ourselves at risk for contracting a novel influenza from birds. I myself had to take Tamiflu because of my exposure to this. For $36 an hour, I don't get paid enough to be patient zero. I do this because I care. Many staff risk liability and angry public reaction. Our food inspectors and our land staff can probably all agree that they don't get paid enough to get yelled at and treated poorly by the public. Now, I learned today that Franklin County has a resolution that is based on conspiracy and misinformation against the COVID-19 vaccines. I can speak for all of my colleagues, I'm sure, that worked during COVID, that this work left its toll on us. When I read that resolution, all I heard in my mind were the weekly calls I had with the coroner for the small county I worked at in Montana, giving me death reports. It was the parent who had a healthy adult daughter who died of COVID 5 days after getting it, unvaccinated. When I read that resolution, it is a kick in the teeth to all of the work that we do. I do not get paid well enough to have to fight at my job to justify it. Not only do we do hard work, but we are under attack. We are looking to you as the board to protect and defend us. We do everything we can to better our communities. In turn, I believe that we deserve better. Thank you.
Anyone else for public comment?
Yes.
Please come forward, state your name, and you have 3 minutes.
Hello, can you hear me all right?
You're okay if you want to stand and say, yeah, you'll just be next.
Is someone on Zoom or is it phone call?
Looked like there's somebody with their hand raised that was talking.
Hello, can you hear me all right?
Yes.
Yeah, who are you? Or state your-
Hello. Sure, my name is Hazel Quack and I'm an epidemiologist here at BFHD. I just wanted to say that public health is more than a career to me. I feel that it is my calling. I too pursued a graduate degree for this work, and in addition, I've completed 2 certificates in specialty areas, and I continue to maintain my medical assistant certification because I believe that our community, deserves the best. I want to also set a good example for my son and my niece, showing them that public service is important. I also want to build a long future with this agency because I believe in our mission, but I also believe that this work requires stability too. Like many others at our agency, I've considered taking on a second job to make ends meet. Some of these folks here do work a second job. The commitment I have to my community is so important to me, but I also need to support my family too. I hope that as we talk about the future, we can find ways to ensure that those of us who dedicate our careers in public service can do this without financial hardship. I believe in the people who serve our community here at BFHD. I know we invest in the work we do each day, pour our heart and soul into it, and that we're also investing in our community's health too. Thank you.
Thank you. Everybody in person. All right.
Hello, my name is Natalie Chavez. Thank you for listening to public comments. I drove around 5 hours from Whatcom County to attend the Franklin County Commissioners meeting earlier today to show my support for the resolution regarding the COVID-19 vaccines. I attended that meeting to witness the passing of the resolution and to thank the commissioners for being brave, being critical thinkers, and for bringing hope to Washingtonians who reside both in and outside Franklin County. My hope is that there will be a ripple effect with similar resolutions across Washington state from county to county. One can only hope. Regardless, that resolution will bring light and truth to years of COVID darkness and evil that we've all had to endure. Who would have thought that numerous effective COVID treatment protocols would be suppressed from community members, like high doses of vitamin D, high doses of liposomal vitamin C, high doses of melatonin, liposomal glutathione, NAC, quercetin and zinc, hydroxychloroquine and zinc, ivermectin, nebulizers, using budesonide in a nebulizer, and the list goes on and on. So many people suffered and died needlessly when they could have been treated humanely without the deadly hospital COVID treatment protocols, which included the use of remdesivir and ventilators. Many people did not know that the effective and humane COVID treatment protocols had to be suppressed in order for vaccine manufacturers to get an emergency use authorization for their toxic experimental COVID-19 vaccines. There are numerous COVID vaccine injured individuals in my Whatcom community, and some who have died, like Tyler, who was a father in his 30s. He suffered a lot and had financial stress in the last days of his life due to all of his medical bills. Prior to his death, he set up a GoFundMe page explaining that his cardiologist had informed him that he would not live without a heart transplant. Tyler wrote on his GoFundMe page, quote, "I was hospitalized for 18 days in St. Joseph's ICU with complications from the coronavirus vaccination. My heart was failing and I had developed 3 blood clots inside my heart and 1 clot in my leg," unquote. Tyler is dead now. He died on January 30th, 2024, and his daughter is now fatherless. There are others like Tyler who are dead now, and Tyler, who was in his 30s, probably had around a 0% chance of dying from COVID-19 in the first place. There has been no informed consent, no transparency, and no comprehensive risk versus benefit analysis of these products that are being given to people before they are being injected with these toxic injections. And lastly, in case there may be any COVID vaccine injured individuals who are here today or who may be listening online, you can find support and resources at the website react19.org. That is REACT19.org. Thank you for your time.
Thank you. Anyone else in the room for public comment? Please step forward, state your name, and you have 3 minutes.
Good afternoon. My name is Ashleen Gardner. Board members, I appreciate my job and colleagues and the privilege of doing meaningful work as an environmental health specialist here at BFHD. I am solely responsible for more than 20 solid waste facilities that provide critical services to over 300,000 people in Benton-Franklin counties. I hold a bachelor's degree in microbiology with a minor in Spanish and a master's in public health, specializing in epidemiology and statistics. I bring all of my education and experience and training to this role. My work involves reading lab reports, analyzing, studying chemistry, reviewing engineering and hydrogeology reports, interpreting complex regulations, and writing compliance letters. I review operations plans that are up to 150 pages long, ensuring facilities meet safety and environmental standards. My inspections often take me into hazardous environments where I wear PPE, including steel-toed boots, a hard hat, and a gas monitor to prevent injury or even is complex and sophisticated. It takes years to develop the hard and soft skills necessary to navigate our responsibilities. It carries significant risk, requires responsibility, and demands courage. Every day we engage with people in moments of vulnerability, addressing their fears and frustrations while building critical relationships. The decisions we make don't just impact public health, they shape the environment, the economy, and the financial stability of families and businesses. Recently, while checking out at Costco, I asked the employee highlighting my items on the receipt how much he made, and he made the same salary as me, despite the job being far simpler. The compensation we receive, to be honest, is not proportionate to the complexity, liability, and responsibility of our work, nor is it sufficient to meet today's cost of living. As a BFHD employee for nearly 4 years, I earned a net income of $68,000 last year, yet 55% of my take home goes towards the basics, including mortgage, utilities, and homeowners insurance. That doesn't include food, clothing, or other essentials for my 2 children and myself. Many months, instead of saving for the future, I find myself withdrawing from my savings to stay afloat. This raises difficult questions. Am I expected to have a spouse or a roommate to make ends meet? Why should I remain in a high responsibility, high stress role for the same pay as a far simpler job elsewhere? And what is keeping me or others in my position from seeking higher paying opportunities? None of us pursue public health for wealth. We do it because we believe in this work. We do it to serve, to protect, and to support our families and communities. But service shouldn't mean financial strain. While the rising cost of living is beyond the control of the BFHD or the board, not caused by anyone in this room, and ensuring that employees are financially supported is within our collective power. Investing in us means valuing the institutional knowledge, experience, and dedication we bring to this organization every day. Thank you for your time and consideration and for your efforts to ensure that the BFHD workforce is financially supported. Thank you.
Anyone else in the room for public comment? If so, please step forward, state your name, you have 3 minutes. Seeing none, have a hand raised on the
Yeah.
Zoom.
Susie Saunders.
Susie, can you hear us?
I can hear you. Thank you. My name is Susie Saunders. I am the union representative for the majority of workers at Benton-Franklin Health District. And I just wanted to say thank you to the staff who bravely showed up today to speak or stand in solidarity with their coworkers to ask for better pay and working conditions at Benton-Franklin Health District. These workers perform critical public health jobs for this community, and they are struggling. So we're asking the board to put their best foot forward in negotiations with Protect 17 and make sure these staff are adequately and fairly paid for the important work that they do. Thank you.
Thank you. Anyone else in the room or on Zoom? Hearing none, moving on to agenda item number 5, senior staff comments. None. Moving on to 6, unfinished business, none. 7, new business, Office of Health Officer update, Dr. Stephen Cragen and Heather Hill.
Good afternoon, everyone. I'm Steve Currier, the interim health officer for Benton-Franklin Health District. I have a couple slides. Let me get started. Oh, it says I need to have sharing turned on. Okay, there we go. And switch. Okay, hopefully y'all can see that. Let me know if you're having any issues. Okay, I'm gonna last month we talked about respiratory diseases. I'm gonna cover them again because we unfortunately are still in our flu season. Influenza remains pretty rapid. I think I may have and I'll point this out on our chart. I may have said that we had like peaked and we're on our way down last month, and unfortunately we kind of hit another stride. Let's see. This is our hospitalizations. This includes influenza, RSV, as well as COVID-19. These are people hospitalized for those conditions. It combines them all, but most of it is being driven by influenza right now. We do have a little bit of RSV still. COVID-19 hospitalizations are very minimal at this time. So this can sometimes happen. Actually, I'm going to go to this is specifically influenza. This is our emergency department data. So let's see our current. Yeah, we are this blue line. Washington is the red line. So a little under 7% of our emergency department visits are for something like an influenza-like illness, which is pretty high. And again, we kind of see that little peak, and then it went down and then went back up again. That sometimes does occur. Sometimes there's even a longer kind of break. We'll see like, you know, a peak in the early winter and then a peak in the early spring. But what this translates to is a lot of people with influenza. You may have known someone. I've known a few people that have gotten influenza this year. It's just been a particularly rough season. I bring it up mostly just to have people be aware. Also, you know, it is putting some strain on our healthcare system. They're not currently overwhelmed, I would say, but we are hearing that, you know, it's certainly causing a little bit of extra stress. Busy emergency departments, busy hospitals in general. Yeah, the flu season is ongoing, I guess, is my current message. It's not too late to get vaccinated. I think we still have several weeks of high influenza activity, or at least moderate influenza activity ahead of us. And we'll kind of see, you know, sometimes flu seasons last, into April. Hopefully we start seeing a significant downturn, later this month and into March, but again, it's hard to predict. Let's see, just looking at RSV, seeing a significant decline in that blue line. This is emergency department visits. So we sustained at a decent level for RSV, and hopefully that decline continues. That's been seen across the state as well as nationally. This is our ER emergency department visits for COVID-19. We remain, between 0.5% and 1% of our emergency department visits are for COVID-19. That's also very close to what our state data looks like. It's interesting. There's been more COVID activity in different parts of the country, although in general, we've had a much milder winter this year than previous seasons in terms of COVID-19 across the country. But it does seem that Washington's been maybe even milder than average compared to the rest of the country, which I think is kind of interesting. Just a couple other things for me to wrap up on. We unfortunately, we talked about last time, we had another outbreak of bird flu in a poultry facility. We are essentially wrapping responses up to that. We thankfully did not have any human cases this time compared to our last time when we had several human cases. We had people working, depopulating these birds, but we think that the level of exposure was a lot less, which we appreciate working with our partners at WSDA, at the facility, making sure that we protected workers during that work. And then we also, I think there's an interesting project going on with some other local farms starting to work with the University of Washington on increasing biosecurity, which means, doing their best to protect, which, farms do, but there's always more we can learn. And this, unfortunately, continues to kind of change. Biosecurity meaning, protecting their animals from kind of outside sources of infection. As I mentioned, influenza deaths, or influenza has been high on this season. We've seen deaths nationally quite high. I just saw a headline, I think early last week, that for the first time since the COVID-19 pandemic started, we've had like more influenza deaths over a week than COVID-19 deaths. So again, just kind of emphasizing how much influenza that we're seeing. And this is just more administrative, but I do think it's kind of interesting. Our previous Secretary of Health, Umair Shah, stepped down when the new governor started in Washington. So the State Department of Health currently recruiting, and it'll be, we work with our State Department of Health quite a bit. I think it'll be really interesting to see kind of who they select, and I hope we can, continue to work together going forward. That's my update today.
All right, thank you, Dr. Krager. Moving on, B, public hearing for OSS rule revision, Erin Hockaday.
Right. Good afternoon, everyone. Erin Hockaday, Senior Manager for Surveillance and Investigation. You have heard Jody Payton, our land use supervisor, present many times on the on-site rule revision process over the last year. So just as a reminder from where we started to where we're at, we started early last year with a public comment period of about 90 days just to get initial input on the draft. Then we put together an industry committee, which was a technical advisory committee that was made up of a variety of representation from people who work in the on-site sewage industry to go through the draft rule changes with us, including a board member on that group as well. Now we're at the space where the draft is done. We've presented the key changes to you. Amanda's done a great job of pulling together everything that Jody's presented to you in the last year into a really simple table format. So as a reminder, a lot of the changes on the draft, if you do look at the full draft rule, about 85% of those changes are state-driven changes that we don't have control over. The ones you see on this page are anything that BFHD has as a local rule, local provision, which we've run again through that industry committee, through you as a board, taking your feedback as well and tweaking some of these. So as a part of our rulemaking process, we do have the requirement that we have to open up to public comment. So again, early on, we did open up about a 90-day period where we did some surveying online. But we're doing it again just to be sure after the rule draft has been finished that people have a chance to look at the final draft and submit any additional comment. So about 3 weeks ago, we published a notice in the newspaper. We published a notice online, and we pushed out an electronic survey and also offered the opportunity for people to call in with their comments or write in by mail. We received one comment. I'll read it to you now. Our single comment we received was from an anonymous submitter, and it said, "I am in support of wastewater-based epidemiology work by BFHD as it supports the health of our community by testing in an anonymous and real-time manner. Please consider on-site sewage testing in rural areas of BFHD, such as schools or government buildings, so that rural areas of BFHD can be covered." So not directly related to our on-site rule revision, but kind of sewage adjacent. And so we'll take that comment in back to our regular program work. This section on the agenda is just to open up to if there are any members of the public in the room or online who have comments specifically about the on-site rule revision. Dramatic thoughts.
Yes. Is there anyone in the room for public comment?
We also did a social media post.
One question I have on here is minimum lot size change for lots with soil types 5 and 6. From 1 acre to 2 acres. So that only affects certain types of soil.
Yeah, Jody can speak a little bit more to that. Some of those, I think the type 5 and 6 changes from 1 to 2 acres, state-driven change, right?
That is a state-driven
Yeah.
change. So,
What are types 5 and 6?
type 5 is a silt loam, sandy, very fine sandy loam, silt loam. Almost 6 is a clay, so you've got just 5, 6. So that finely textured soil does not accept water very fast. And so it takes longer for the water to move downward. And so to compensate for that, you have a bigger drain to spread the water out instead of keeping it in a small area that percolates really rapidly.
So with the growth, what we have in Franklin County what is the minimum lot size that you can put a septic system on? All on the soil side?
It depends upon the soil type. There is a minimum gross land area of 1/2 acre if that lot is supplied by a public water supply. If the lot is a well, if it's supplied with water by a well that's on the lot, because there is a 100-foot radius around that well, the minimum size is 1 acre, except for type 5 and type 6, where it went to 2 acres. But, a couple things that we feel are wins. We did have what's called usable land area, and that is area that can support a septic system. Because the soil is permeable, there's enough of it to clean the effluent of the sewage before it gets to groundwater or any sort of restrictive layer. And that has been reduced from 48 inches to 36, which will allow a lot more lots to be developed. Because some of them don't, at this point, they don't have enough soil. I have 2 plats on my desk that are just waiting for this to go through so that they will be able to go through with their subdivision because they have soil at 40 inches instead of 48. And we also reduced the amount of square footage of usable land area. So it used to be that each soil type had a minimum usable land area, places where a septic system could go. And that ranged from 12,500 all the way up to 20,000. And all of those numbers were halved. So they won't need to show as much usable area for a septic system to be able to develop that lot.
off the beaten path, but on a septic system, if you're going only 3 feet, what depth is usually electrical ran at?
About 12 to 18, but I have nothing to do with electrical, honestly, so, but it is usually lower than electrical.
But it is going from 4 feet to 3 feet.
But that's vertical separation. You still could have 3 feet of that septic system in the soil and then 3 feet under it. So you've got a total of 6 feet.
That's going out to the drain field.
Mm-hmm.
And what is the drop in elevation? You have 100-foot long drain systems that have to be perfectly level, or is it allowed to have some slope to it?
It can have some slope to it. Level is preferred, but it can have up to half an inch every 50 feet.
Thank you.
2 inches every 50 feet.
Mr. Chairman,
Yes.
it says removes the requirement for septic tanks being on the BFHD approval list. How many tanks do we get to choose from now from the state?
If they're on the state list,
How many are on the state list?
I honestly don't know because I've never had to deal with that list. We've always dealt with ours. And because of the expense of transporting a septic tank, which if it's a concrete tank is quite heavy, people tend to buy local. So we're getting them from 2 local suppliers, one of which is no longer in business. And now there's another polyurethane tank that is easier to transport. It has some of the little downsides to it. It does have to be put in by an installer to maintain the warranty on it because there's a mid-lateral seam. But those tanks can now be put in and they don't have to go through the process to be on the state's list and then be on our list as well.
All I'm just saying is, for all of our patrons out there, it'd be nice to know what this list consists of. Maybe we can.
It is on the website that they can go
Website.
to.
It's on your website.
The health
On the
website,
Department of
and yeah,
Health.
Commissioner Didier, I think, we think BFHD was a little ahead of the curve on years ago, they developed their own list. And then the state recently came up with their own list. So we figured it's not worth, using our staff time to maintain this list anymore.
No, but maybe just grab that state list and put it on your site so people
Yeah, that's a
know
great idea.
what's available.
Right,
Okay.
right. I don't foresee a lot of other tanks coming in just because, especially.
Innovation happens every day.
Yeah. So.
Okay, well, you have the key changes. Some of the questions I think Commissioner Mullen was asking were great questions. And in terms of land area, some of the changes we've been making will open up a lot more opportunities for developing in our area while still being protective of the environment. Many of these changes, again, all of the changes were fully supported by the industry committee. And I think we'll make some good gains while also bringing us up into alignment with the state rule in a lot of areas where there was no purpose for us to maintain our own rule. So we did come in alignment with a lot of the state code, which is a change from the past. So our next steps here, we've got this for you on the back page. There's a QR code that will go directly to our rule change website where there's a copy of the full rule draft in case you want to read the whole thing. But this highlights the changes that are specific to BFHD, which we have kind of wiggle room over. Our intent then is to come back in March to vote on this for a final vote. The state on-site rule, the updated state rule goes into effect April 1st. So we have to have our rule passed and done before then, or else we're going to default to the state rule, and we don't necessarily want that either. That's going to cause quite some ripples. So we intend to come back next month's meeting and ask for a vote on this as a resolution. As I mentioned, the state code is in effect April 1st, 2025. Our next step after that is February 1st, 2027. In the state rule, there was a delayed implementation of property transfer inspection requirements. This is a state requirement that starting in February 2027, any property undergoing transfer, so when you sell a property, there's gonna need to be an inspection of the on-site system to be protective for that new owner, to make sure that when they're buying that home, they're getting something with a functional septic system. So we're in progress of certifying and licensing our local maintenance, it's our installers, our local maintenance providers to do those inspections. It won't likely be us, but they'll need to be submitted to us. So ahead of that, there will likely be some policy development, some program development. We may need to expand staffing. We're gonna need to figure out what that looks like. Is that property transfer inspection will be probably its own program here. So that's our next step to kind of build towards. Any questions?
One more.
Yeah.
On the second page, homeowners must pass a test and meet additional requirements to install gravity systems safely and correctly. If you're inspecting them, why? If you're going out to inspect them, why do they gotta meet a test and additional requirements? What additional requirement?
There is an additional inspection. The reason for the test is to make sure that the homeowners are well versed into what they need to do to put in a system. When the test is not, we don't expect them to take the installer's test. I am expecting them to give me the distance between the house and the tank, between the tank and the drain field. How much fall is there between the drain tank and the drain field?
That's all done in your inspection. So why is there additional requirements?
The additional requirement is right now that they pass the test so that they're aware of what the rules are. And so that we can come out before they get too far into the installation and be able to correct any problems when it's one line versus another line. I have been out on homeowner installs and 5 times. I've had to go to Prosser every single time to go out there to inspect that system that still was not done correctly.
That's why I said you should go with virtual inspections. That way you're not making that drive.
But it sounds like too, like, it's kind of like a final inspection, like.
Yeah, that's the
you're-
final inspection.
Yeah, so to me, that makes sense of why, like, for me being a builder, regular inspections, okay, we're doing framing inspection, installation inspection. Okay, I'm done with the project. We have to have a final inspection for the inspector to come back out on site. Or electrical wise, they are doing more virtual. I get your virtual point, but I get to where she needs to go.
It just
out there.
says homeowners. That means private citizens who want to put in their own must pass a test and meet additional requirements. I don't know why we're putting that on the homeowners. If they can't install it right, then they're gonna have to pay somebody to do it.
Well, no, but that's,
If it doesn't pass your inspection, then they're gonna have to have it done right.
But then we're also looking at most of the time, the reason that the homeowner did it themselves was to save money. And they are on a tight budget trying to build this. This hopefully is going to offset that so that they can get it right the first time. And have that partial inspection so we can make sure that the lines are in level.
I understand all that.
before they
Yes.
backfill, like, yeah, because it makes sense what you're saying is like, okay, I'm gonna open up, do the trench, the gravel work and everything. You look at it before I backfill it. And then once I backfill it, that's your final inspection, like, right?
We give them the approval. to
Yeah,
backfill,
the
but-
approval to
right.
backfill, and yeah,
Mhm.
so,
If you hand out a paper of how to do it, you should trust them to do it. And when you inspect it, if it's not done right, they gotta do it right. And that's their penalty for wanting to do it. I mean, right now, you're asking for more to be, these homeowners must pass a test. I mean,
A licensed
that's
installer has
offensive to
pass
me.
the
I'm a
test.
farmer, okay? That's
Mhm.
offensive to me. Let's just put it plain and simple.
Okay.
I guess my question on it is, and meet additional requirements.
That's, yeah.
The
What is-
additional requirement at this time is that extra inspection. That is done.
Is this a state requirement or
This would be ours.
this is ours? Okay.
I have one other question. It says at the end of each lateral line, there must be an observation port. So if you have a drain field with fingers going off, that every single one of those fingers has to have an observation port?
Yes.
That's something new, isn't it? Because I've never seen one like that.
It's a requirement on an engineer design system when they have pressure distribution. They already have to have this. But this is the state requirement that the gravity flow systems also have to have that. And a lot of that is driven because of the homeowner maintenance and observation and making sure their system is operating properly. It's, if they are getting backups into the house, they can look at the end of the line and see if they're getting water. They can tell if their drain field's failing by looking into that observation port. And it doesn't have to be.
It is something new, though, because I.
Yes, it is something new.
But it's state requirement.
And is it something that you come out like twice, right? Like you would inspect the first time, inspect the piping, and then, okay, you're good to go, backfill it. Do you still come back out and look at the backfill once the backfilling's done?
Only if
Recovery?
the backfill was there was too much backfill
Uh-huh.
or there was too little and they have to add.
But long story short, you would still come out and do a final inspection once it's backfilled, correct? To approve.
Only if they don't get the 12 to 24 inches
Yeah.
of cover soil.
Yeah.
Just to verify that
I
that
mean,
was done.
to me, that kind of makes sense to where it's better for her to come out once or twice or three times. Because then if you come out one time and they already have it backfilled, then it doesn't pass, then the homeowner's spending more money having to dig up, run a
And
new pipe.
I have one of those right now
Yeah, oh, you do?
in Franklin
See,
County.
Yeah, so it makes
Where
sense.
they
go out
have to
there.
dig up the lids to the tank, they have to dig up the transport line, which is unfortunately at least 120 feet away from the tank. They have to dig up the whole header system and 3 parts in the line to make.
Especially if they're doing it for themselves instead of paying for a contractor to come out and do it that's done multiple ones where it goes a little faster, but yeah.
I would say that's where we really wanted to go with this too, in terms of the homeowners and the comments about the test is what we've seen with these homeowner installs. Not always, some of them do very well. But they often take us more staff time to drive out multiple times. And then it ends up more burdensome on the homeowner when after an install, you're this far into the process and now we have to have them redo things. Whereas we could work together to check understanding before the process starts. And I know, seeing something on here like passing a test looks onerous, but in talking to Jody about it, simple, thinking like the level of a test you would need to get a food handler's card or something very low level that checks a very basic understanding of the critical points that could ultimately cost them a lot of money if they install it, without that forethought. So
Right.
it may not seem like it, but it is trying to be protective of the homeowner and their bottom line in terms of their finances there.
One thing that I do see a lot is that when they rent the backhoe, they get the backhoe with the bucket that's on it. They need, the drain field length is determined by the width of that backhoe bucket. And if they get a 2-foot bucket, they have to add extra lines.
Cause you need so many cubic feet of.
Yes.
Yeah, exactly.
Yeah, so, just to make sure that they know that the width of the line should be 3 feet. And if it is 2 feet, it can be 2 feet, but you need more of them. And a lot of times when they're renting the backhoe, they don't think about the width of the bucket. It's just, that's the bucket that was on there. Yes.
She's first.
Well, I was just gonna say that, I think there's that basic need for basic understanding, make sure it's very simple so that anybody, but it also seems like it's partly a cover for us as well, because, yes, you can hand them a flyer, but if somebody has taken a test and you have said, I've been through this process, then if there's issues coming back towards us, you can always point to, we were clear on what the expectations were.
And I would be happy to give you the test.
And make sure that, yeah.
Fee for the test.
Probably get that waived.
Well, sometimes too, though, it's
And not for you, she said. For the owner, yeah.
when we moved up here from Meridian and moved up to the house was a lot older and my dad was gonna fix the septic system. But first rodeo, it was cheaper for him to hire someone to come in, redig and stuff. So I get it. If the homeowners is for first rodeo, there's gonna be more issues on the first rodeo versus if they've done already 3 or 4 or 5. You know what I'm saying? Like, so what you're saying is making sense.
And that person,
Wait a subsequent test if they've done multiple and show burden, so that it's.
and that person that's having to redo theirs is a megaphone for everybody else out there. They learn through experience. So when they have a failure like that, all the neighbors are gonna know about it. That's how it works. If you don't allow somebody to fail, they'll never learn their lesson.
But they are failing.
Yeah, I know.
Yeah, I don't know if that's really our-
So.
All right, thank you.
Comment? All right, so Jody's available for more conversation if anybody wants to talk through any of these in more detail. And then next step will be next month coming for a vote on the draft, and then we're going to work on the state requirements for property transfer. We'll be doing a lot of outreach to industry, realtors, everybody involved in that process. So you'll hear a little bit about it as it develops.
So one quick question. So every time a property changes ownership, the health department will have to go out and do a septic inspection.
Yep. Yeah.
And inspection has to be done on the system. It won't necessarily be us. Some LHJs are planning to inspect them. Most are going to be certifying installers, maintenance providers to do those inspections, and then they will just submit the inspection reports to us. So we're planning on going that model because we don't have staff capacity to inspect every property transfer of the septic system.
Is there a way to know which ones of these are state and which ones are our department?
It says,
Do they differentiate? Because I don't see it on this paper. Which ones are the state and which ones are ours? I just found out that one with the test is.
Yeah, our intent was just to put the ones on here that were our changes, but it looks like maybe a few extras snuck in there. So we can update this and maybe do a modified version and send it out to you all.
Yeah, just email it to. And is there gonna be another comment period on this?
No, this is it.
From the public, no public more comment.
do you need to do online though?
It's been open for about a month now, so.
Is there anybody online for public comment on this?
Test already been developed. Is that something that could be included in the matter of, information on the QR code?
I don't
so
know,
we can
have you
see it?
developed questions? No, not yet.
Okay.
Do we have any other counties that do that where we have maybe some samples of what it may look like? Yes. So we can
Adams
include-
County, probably, there's some others as well.
Okay. More on that then. Thank you all.
Oh,
you're gonna.
No, we'll send you a modified list. Send you a modified list.
Please.
Yeah, we'll go back drawing board.
All right, new business, discussion of next steps for OSS rule revision.
With that.
All right,
Twofer.
oral health update, Carla Prop.
Everybody, Carla Pratt, Senior Manager of Community Health. One of our goals for our strategic plan is to make sure that we're continuing to engage you in the various amounts of work we do here at BFHG. And so you've heard a lot about on-site sewage today, so I'm just going to give you a brief update. February is National Children's Dental Health Month, and so we are taking this opportunity to share about the oral health program here at the Health District. First, I'm just going to talk a little bit about why it's important, and then because we'll focus on the programs for children. Lindsay Palmer and Dana Harris are the staff listed on the slide there. There are two amazing public health dental hygienists who work part-time here at the agency. Next slide. I'm gonna change that to the right view, so they can see the slides. So primarily I want to focus on the awareness about the oral systemic link. And this is communication and information that's been happening for quite some time. A landmark study was the first to show that oral germs, such as those that cause gum disease, frequently enter the bloodstream and spread throughout the body. This discovery links the gaps between dentistry and medicine. We like to say that the mouth is a portal to the body. It's not a separate function. And so we have some combined issues there. And one of the things that we know on is that when we focus on the importance of oral health in relation to our overall health and quality of life, if it's left untreated, tooth decay, gum disease, and other health issues, like you see on the slide there, cardiovascular disease, endocarditis, pregnancy and birth complications, including prematurity, and pneumonia. Poor oral health has also been linked to osteoporosis, Alzheimer's disease, certain autoimmune conditions, and even some pancreatic and oral cancers. And so when we talk about why oral health matters for kids, we know that poor oral health can affect a child's school performance, ability to pay attention, speech development, next slide. The items you see on the slide. CDC reports that over 34 million hours of learning time, of instructional time, are lost each year due to unplanned and emergency dental care. And that doesn't take into account the hours that are lost due to pain and inability to pay attention, and being hungry because they weren't able to eat well that morning because of poor oral health issues. So in addition to the chronic diseases that we stated on the previous page, we take into effect these, really those direct impacts on children's learning. So next slide, please. What does BFHD do about this? So public health relies on data to make data informed decisions. We've talked about that in the various formats. And so one of the things that we do is collaborate with the Washington State Smile Survey. We collaborate with Acora and the DOH to conduct the survey. The Smile Survey is conducted every 5 years to obtain that statewide and county level data on oral health. We finished second and third grades, so the data reports on those are coming soon. And very soon we'll be working with kindergarten and subsidized preschools to get the next set of data for the Smile Survey. Next slide. In addition to the data we get from the Smile Survey, we also have data from the Healthcare Authority. And when we talk about health utilization, this is how many kids have dental coverage through Medicaid and actually are seen by a dental provider. So you can see in Benton-Franklin County, we're only at about approximately 50% of our kiddos who are eligible to be seen that are actually getting in to have oral health care. And that's a preventative and responsive care. Next slide. Those under 20, we're looking a little bit better. Often when they're in school, they have the school nurse or other folks advocating for them to get into care. And so you can see though that we're still only around 60% of youth that have gotten any kind of dental service who are eligible. So every child that has dental insurance, but not every child has a dental home that they're accessing. And that's one of our goals to help improve that and bridge that gap. Next slide. So one of the ways that we do this is work with medicine and our medical partners on an initiative called Mouth Matters. So one focus of the local ABCD program is to include the medical team in our efforts to improve oral health. And so we've worked identifying billing points so that medical providers can provide oral health screenings and get reimbursed for that so that we have additional folks screening kiddos to make sure where they need to get into dental care. Okay, next to last slide. We also have a preschool dental screening program. So our hygienists support a notable improvement. What they report is a notable improvement in untreated decay during last fall's screenings. And so I just wanted to point that out, that one of the ways that we do this is that we visit classrooms, we do oral health lessons with kids, they perform dental screenings. Those screenings identify untreated tooth decay, and then they work really hard with the parents and dental providers to get them in soon and get that dental care taken care of. They're available as a resource or support to parents and provide that care coordination and linkage to resources. And so our goal is that every child that we serve in preschool programs is linked to that dental home by the end of the school year with our interaction with them there. And so the addition of Mouth Matters, the selective preschool engagement, and our ABCD program make a big difference in bridging that gap to care for kids. So next slide. Behind each child, it's not accessing care, there's a story. So when a family connects with us at BFHD and our ABCD, which is access to baby and child dentistry, so they work with the youth 0 to 5, and then also with anybody who's classified under the Division of Developmental Disabilities Program. So our children and youth with special needs that may need extra resources to connect to dental care. So we strive to dig to the root of the issue to overcome that final hurdle to care. And sometimes that means involving the pediatricians, school nurses, family support specialists, or advocates at the preschool. And we really work to provide meaningful case management and care coordination to get these problems resolved. So we have enrolled quite a few new dental providers in the first 2 months of the year. Actually, we've enrolled 3 new dental providers in the ABCD program, and working with CDC to make sure that everybody who graduates their dental hygiene program graduates with their ABCD certificate. That is a quick overview of our oral health program.
Thank you.
I did notice on the thing it said sleep. Like that's kind of the issue. I think the biggest issue is getting your kids to turn their phones in by 8 or 8:30.
Hopefully our babies aren't having phones before they go to bed, but you're right, that could be an issue. But airway issues, when they have poor oral health, airway issues cause sleep issues. So
I just have to tell my kids every night, hey, it's 8 o'clock, turn your phone in.
yeah. I'm going to go to the dentist if you don't.
Yeah, there you go.
All right, 8 announcements. Are there any announcements? Hearing none, moving on to 9, approval of vouchers.
I move to approve, Board of Health approves, approve payment of voucher number 04/2025 through 10/2025 in the amount of $1,440,000.
Better start over.
That's too much. $1,044,895.93.
Perfect.
I second it.
There's a motion and a second. All in favor signify by saying aye.
Aye.
Aye. Motion passes. Executive session, review of Qualifications for an applicant for public employment under RCW code 42.30.110, section 1, section D. For approximately 15 minutes. The time is 2:35. To include full board, Brandy and Danae. And we will reconvene at 2:50. So we came out of executive session with no decisions being made, or closed session. Oh, executive session, with no decisions being made. We're going to extend for 5 minutes. So at this time, which is 2:52, we will go into executive session for 5 minutes. So we came out of executive session with no decisions being made.
If I can, let's actually make a motion. I would like to have the district engage the health officer. That's about prospects for hiring. That's possible.
We have a motion. Do we have a second?
Second.
All in favor signify by saying aye.
Aye.
Passes. Closed session. Review of collective bargaining under RCW code 42.30.11, I'm sorry, 0.140, subsection 4, subsection A. For 10 minutes to include the full board and Brandy and Janae. So at this time, we'll go into closed session. The time is 2:53.
Yep.
For approximately 10 minutes. We've come out of closed session. The next date of the next meeting is March 19th, 2025. Is there any other business for the good of the health department?
I just hope you guys had all one wonderful Valentine's Day.
The best.
Yeah.
All right. So with no further business, this meeting is adjourned. Thank you.